Welcome, welcome. If you're just now joining us, we're giving it a minute for everybody to arrive in the webinar. We are glad that you're here, and you get a gold star if you're on now because you're a minute early. So we are just gonna let it roll for just a minute. We've got folks who are joining us here in the webinar, also folks that are joining us on Facebook right now for our webinar. So if you will sit tight, you are in the right place. You've got time to pour another cup of tea, get a little water, take a stretch break, whatever it might be. We'll get started with the webinar in just about 1 minute. Again, if you're just now joining us, I'm seeing the participants tally up. You are in the right place. We've got about 1 minute until we get started. We just want to make sure that everybody has an opportunity to join, and we know that sometimes it takes us a little bit to get into the Zoom platform. So we're going to let everybody have just a moment to get settled. And before we get started with what I think will be a really exciting webinar today. But if you're here now, you've got about another minute. If you need to stretch, get up, grab another cup of coffee, cup of tea, whatever it might be. You're in the right place, and we are glad that you're here. So we're going to give it just another 30 seconds, 1 minute, and then we will get kind of jumping into the conversation. But again, we're glad that you're here, and you are absolutely in the right place, and we're glad that you're here. All right. Well, we are at about 1:01 p.m. my time here in Portland, Oregon. And I know that we still have some folks that are logging in and joining, but we've got housekeeping here at the beginning before we get started. So there's still a little bit of time for folks to join before we get into the meat and potatoes of our presentation today. And we are excited that you're here. You're in the right place. If you're here for the Compassion and Choices National Healthcare Decisions Day webinar, we're going to go ahead and jump into the topic today. And I want to start by introducing myself and welcoming all of you. My name is Matt Whitaker. I'm the National Director of Integrated Programs for Compassion and Choices. And I'm excited to moderate and be a part of this exciting conversation, which is about engaging the next generation in end-of-life planning. And we're doing this today in honor of National Healthcare Decisions Day. And if you've never heard of National Healthcare Decisions Day, it's been around for several years and always on April 16th, always on the day after tax day. So what's the idea? What are the two inevitables in life? Death and taxes. So on the 15th, we take care of our taxes. On the 16th, we make sure that we have a conversation about advanced care planning. We use this as an excuse to re-up our commitment if we're the type of person who has done this in the past, to explore what that means, and to bring new people into the conversation about end-of-life planning. I know we've had a couple of people who have joined in just the last few minutes. So before we jump into the presentation, I do want to introduce myself just one more time and say my name is Matt Whitaker, and I'm the National Director of Integrated Programs at Compassion and Choices. And we're glad that you're here today for this webinar. Now, speaking of the webinar, a couple of housekeeping things for you to know. The first is you don't have to take notes. There's no test at the end of this. And if there was, it would be open book because we are recording today's webinar. All of our webinars, we make sure that we have available moving forward so that you can access them at any time. So know that today's webinar is being recorded. And if you find it meaningful, we encourage you to share it with folks in the future. The other piece to know is that we want to make sure that we're being responsive. So we're going to have a good amount of time today to answer questions that come up as you listen to the conversation. And because we want to make sure that our recording goes well and so that we're not talking over one another, the way that we're going to do questions and answers today is by submitting those questions in the Q&A box. If you look at the bottom control panel of your Zoom, there is a section that says questions, Q&A, and you can populate your questions there. Those will make their way straight to me, And during our question and answer session, we'll make sure that we get to as many of those as possible so that we answer those questions for you. So just a couple of housekeeping pieces. Again, feel free at any time to add your questions to that Q&A box. We'll make sure that we get to as many of them as we possibly can. And finally, I want to welcome everybody today on behalf of Compassion and Choices. Some of you are longtime supporters and friends of Compassion and Choices. So for you, I say welcome back and thank you for joining us for another webinar. If you're new to Compassion and Choices, if this is the first time that you're joining us on one of these webinars, and maybe the first time that you're hearing about this organization, I want you to know a little bit about us. Compassion and Choices, we work to improve care and expand options and empower everyone to chart their own end-of-life journey. So what does that mean? Well, it means that we believe that people at the end of life should be able to exercise the same values with which they lived the rest of their life. And we do that by advocating for laws that support people in that way, educating and empowering people to make these decisions through things like these webinars that we're doing today, and through our planning resources that we'll talk about in a moment. And also through supporting people, both through education and emotional support through our online tools and resources and our consultation services. So we're a nonprofit organization that's committed to this. We've been around for over 20 years doing this work, and we're excited, if you're new to us, to meet you. And again, if you're someone who has been a part of this movement, welcome back. And we want to express our gratitude for taking time out of what I know is a very busy time of year, as we all are rushing towards summer, to talk about what I think is a really important topic. Before we get into the content of our presentation, I think it is important for us to take a moment to acknowledge where we're at right now, both personally in the physical space that we're in, but also collectively. We are in a moment of a lot of grief and trauma that is occurring on a national and a community basis. We also sit today here at Compassion and Choices exactly a year after the first time that we did one of these kind of virtual gatherings of people, as we began this process of figuring out what it meant to live with a national pandemic. And we know that there are people on this call who have lost loved ones, are people that are close to us, maybe who are right in the midst of grief right now. And so I want to acknowledge that that is in the room with all of us here in this space. And also acknowledge that sometimes when we engage in these webinars, we don't take a moment to recognize the amount of community that we're participating in, truly. I know sometimes I'm guilty myself of sometimes I have something on in the background while I'm have a hot pot on the stove and I'm working through different things, and I don't take a moment to acknowledge or reflect on the collective experience of hundreds of people sitting in their homes, engaging in something together. So I wonder if, as we jump into this discussion, we could take a moment to acknowledge that, to center ourselves in that moment, and to collectively come together. And so I'm going to do that, and I invite you to do that by just taking a deep breath in and out. Again, in and out. If you're in a space to do so, or if you're comfortable doing so, sometimes it's helpful to close your eyes as you do this. Again, take a breath in and out. And just survey your thoughts for a second. See what it is that might be intruding in the moment, what it is that might be keeping you from being truly present with the people who you're in community with today on this webinar. And we're going to take another deep breath in And as you blow it out, I invite you to see if you can push those thoughts away, focus on those breaths, and focus on the people who you're here together with. Again, one more breath in and out. And opening our eyes, we come back to the room. Thank you. Thank you. It's moments like that that remind me how fortunate it is that even in the midst of great challenges, great grief, great trauma, we are together in our own way. And so I thank you for allowing us to be together with you, allowing us to be in your homes today as we jump into this topic. Now, today's conversation is really, it's one of kind of the more qualitative ones that we've had on these webinars. We do a lot of conversations about concrete steps that you can take. And here just on this slide is a sampling of all of those that are available on our website. We have things like from our National Healthcare Decisions Day last year, where we went through our end-of-life decisions guide and toolkit. We have conversations about grief and loss. We have conversations about what it means to plan for the end of life in the midst of the COVID pandemic. Things that are really about kind of these concrete steps that we can take. And we spend a lot of time talking about that, but what we don't talk about as much is some of the human aspects of what comes to play when we talking about end of life and planning around the end of life. And a topic that's come up often as I've discussed this with people is, how is it that I have conversations with people across generations? Are younger people interested in hearing about the topic of end of life planning or end of life care, or just even the amorphous idea of the fact that we're all mortal? And so I thought that today, since we do have all of these sustaining materials available, that we would instead focus on some of those pieces. But I want you to know that if you're wondering, what steps could I take around my advanced directive? What does it mean to plan for end of life with dementia? All of those things, those resources exist. We're going to talk about them again at the end so that you know where to find them, but they're there for you. And available, as today we could talk about a little bit more about what it means to engage with this topic and younger generations. Now, along that line, you may have seen in our winter magazine, and if you haven't, this is available on our website, we did a big spread about generations, how generations align around end of life. This was Anna Camp was on the cover of that magazine in winter of 2021. It's still out and available and on our website. And it was really interesting. We surveyed and spoke to people kind of across generations. And what we discovered is that we're really all on the same page. We all value autonomy. We all think it's important to be able to speak our own values into the end of life. But we do have kind of, our own little quirks that we all have as various generations based on the things that we experienced in childhood and in our formative years. So if you haven't read this article, I just want to encourage you to do that as well if you're the type of person who's interested in some of that larger data. Again, this webinar is meant to really encourage you to have these conversations with people who are in younger generations. And I find this article encouraging as well. You may see here that it says Americans support medical aid in dying across different age groups. So a small little snapshot into how it is that people think about end of life care, but you'll see that the support for this actually gets higher as you look at younger generations. So in fact, not only is there interest in talking about these pieces, but there's huge amounts of support for talking about end of life and towards the movements that we're working on to realize expanded options at the end of life. So again, I encourage you to look at that, which is really a deep dive into those generational pieces. And then now, before I take the slides off the screen and we jump into our conversation, I want to take a second to introduce who it is that you're going to be hearing from today, who I am very excited to be in conversation with. Two people that I find personally fascinating. And the first is Mackenzie Hampton, who is the Executive Director of Serenity Supportive Care, which is a community palliative care practice here in Portland, Oregon. Spoiler, Mackenzie and I worked together in hospice at one point, and she was a exceptional advocate for people in the community, and also just an all-around good person. She's been working with the aging population for 7 years, specifically in hospice for the last 5. And she has a real passion for helping patients and their families realize the final moments that they hope for, and to find joy at the end of life in those special moments. She wants to kind of remove the dark, scary culture that we have around end of life, and to do that across generations. And she also wants to bring these conversations more into our normal life through things like today. She's also a great adventurer. I've been tracking as she has created a veritable farm at her home with chickens and dogs and all kinds of wonderful things. She likes gardening, hanging out with her fiance. Is a much better skier than me, and an all-around great person. So we're very excited that Mackenzie is here with us today. We also have with us Megan Williams, who we hear from after Mackenzie, who is a death doula and educator who was born and raised in Portland, Oregon. And Megan brings a whole host of experience to her work. She's been a stand-up comedian, which I think you will see when she talks, because she's a great person to listen to. She also spent a decade as a public educator working in special education before finding her real passion around end-of-life care, and specifically around educating and working with families as they navigate all of the host of things that come to play at the end of life. She also serves as the online course director or coordinator for Death Wives, which is a collective of death and dying professionals who are hoping to change the way that we do death in America. And I encourage you to look up Death Wives. It's an incredible program, both for education, but also just really neat people who have gotten involved in that movement. They provide affordable courses, monthly events for individuals, for family members and practitioners, focused on all sorts of topics, from aid in dying to community grief to how to create ceremony at the end of life. She also consults with families and other doulas, using her background as a special educator around the intersection of developmental disability and death and dying, and how those two things play together. When she's not working, we just had a great conversation, all of us, about how much we enjoy time outdoors. She enjoys sitting on her porch, spending time with her family, including her 16-year-old, who is now taller than her, which that is a terrifying thought, having a new child, that she might one day be taller than me. So we welcome you, Megan, to our conversation as well. And I'm going to stop sharing my screen so that we can be able to see one another, and that you can witness this conversation. So I'm going to start with Mackenzie with some questions. And I want to ask you this, especially related to the fact that we're talking about how generations work together on this issue. You work in a field that primarily works with older adults, but where the average employee, the person who's a caregiver or a nurse or a social worker or a chaplain, is much younger. So how did you become involved in that field of hospice and palliative care? And what do you see that draws people to that work, again, across generations?
Yeah, thank you for the question. So I really came into hospice and palliative care by accident. I really fell into it. Out of college, I really focused in college. I worked in cross-cultural communication, international studies. I really wanted to do work. I didn't know what I really wanted to do, but I knew I wanted to make a difference in some sort of human services. And coming out of college, the first job I found was working in a nonprofit assisted living facility, working with people 55 and older, mostly low-income, Medicaid, underserved population, some with substance abuse issues, homelessness, a lot of social issues, everywhere to, the older, great generation, 90-year-olds with, levels of dementia and Alzheimer's. And in that work, I just really found a great love for it. And really, I found that I was able to do the work that I wanted to do right here in my local community, that I could make a difference here. Instead of going abroad, I could really see that, wow, there's a lot of work that needs to be done right where I live. So starting in that process, I applied for a job. I didn't really know anything about hospice. I was in my early 20s, and I took a chance, and I really fell into it. I think that in my job interview, I think that they really just saw something in me that I really didn't even see in myself in myself, and I really had no idea what I was walking into. Um, I remember my first experience working with a patient or working with a family, talking about hospice. I was terrified, absolutely terrified. Um, Growing up, I didn't have, I think a lot of, you're kind of asking that question as well, like how do a lot of people in our generation get involved in the work? I see kind of two groups, and a lot of it is they have some kind of personal experience, maybe a parent or a grandparent that they saw walk through that process, and it was meaningful for them in some way. For me, I really didn't have that personal experience. I certainly had grandparents, but I wasn't really up close and personal. I moved around the country a lot, so I was kind of like a satellite kid. So I didn't have that intimate experience. So I walked into it really blind. And yeah, I remember the first phone call I made. It was for a patient who was in the hospital and had a new diagnosis. I couldn't even tell you what it was at the time. And they were recommending hospice. This person had never heard the word, had no idea what it was. And I, as like a 23-year-old making it somewhat of a cold call, it was a terrifying experience. But through that, I think I'm a great example for it, because I really was of that younger generation who had really limited exposure to death, and found it to be the most meaningful work I could ever dream of. It really just kind of found me. So yeah, that's kind of how I fell into it. I just started working, and I realized this was the most potent experience. All I knew was that I wanted to make a difference. I just wanted to know that I was making an impact. And I had never found something that was so intimate. And, at the end of your day, every single day, you've visually, experientially made a difference in somebody's life. And you could feel that on a day-to-day basis. It was very experiential. It was very impactful. So that's kind of how I fell into it. It was really just somebody saw something in me, and I went with it. And here we are, many years later. And it's been, the best experience I could ever hope for. I think, powers of the universe kind of found us into this, and here I am. So yeah, so that's kind of my background. What I find with other folks my age in the field, like I said, I think there's a good number of people who've either had a personal experience, or I think a lot of it too, I think we assume that if you go into hospice and palliative care or the end of life aging population, that you do have that kind of personal experience. Oh, well, who did you know that died or whatever? What was that story for you? But I think that we forget or assume that. And for a lot of people, I think that they just want to make a difference, just like me. They don't know where to put that. I felt that energy very much, that I wanted to do something important, but I didn't know where to put that. And in healthcare, it's a growing industry. We're an aging population, so there's a lot of jobs. And I think that younger people kind of fall into it knowing that they just want to give back. I think they just want to make a difference and feel it in a tangible way. And starting in that work, you really can't know it or feel it until you're really doing it. And so I think a lot of people kind of fall into it and say, hey, well, this is really, I didn't know this is what I was meant to do, but this is what I was meant to do. So I think, there's an intrinsic quality to people that they really want to give back. And I think that as well, we in our culture, we've kind of forget how much our older generations impact us. And I think that it's really built into us to want to take care of them I think that that's really been kind of shaved away from our culture, but I really think that it's still embedded in us. In humanity is this real quality of, we are a community, and we are, the weakest link and the strongest link. The community is only as strong as its weakest link, and that desire to lift up and build, I think, is within all of us. So I think a lot of people really don't know what it is. They couldn't explain it to you, but it really is on a kind of a deep experiential level that they find themselves in this work.
Beautifully said. Wow. And you talked about the personal experience side of it, and how there are people who have these encounters with it that push them towards the work. I wonder, kind of taking a step back from that, I know a big portion of your work is working with families, both educating them, but even sitting vigil with them and spending time with them in really formative moments. I wonder, how it is that you see different generations interacting in those moments. How is it that children and grandchildren approach the moments versus how it is that others do? Have you seen any kind of difference there? And how do people tolerate that? How do they engage with it? Yeah.
Yeah. You know what? Thinking about this conversation today, kind of forced me to really think about these questions that I live on a day-to-day basis, but I don't really give too much thought to. But in preparing for this conversation, I was really thinking about the family dynamics are a part of our day-to-day life, and what I find that may be surprising to people is that younger generations, children, younger adults have a curiosity about it that a lot of older people assume that they don't. I think that there's an assumption that, and maybe it's not an assumption, I think it's also a protectiveness, because they want to protect, their children from death. I mean, that's a normal thing. But I think that it also is a really, it's a disservice, because I think there's a genuine curiosity. I think they really want to talk about it. They've never really had that exposure. And they don't know how to, because just like me, I never really thought about it until it came into my life. But there was this intrinsic curiosity. So what I find surprising is their openness, their curiosity. I think it is something they want to know more about. They want to be a part of that process, and I think that older generations, what I see most often is they want to protect them from that reality. Oh, grandma doesn't want their grandkids to see her at this stage. She wants to protect them from the reality. But I really think that that's a disservice, and they feel that grief even more so because they were separated. So I definitely think that there's an opportunity, there's a curiosity. I don't think that it's really been tapped into because of this assumption that it doesn't want to be talked about, that it would be very upsetting. Let's not upset them. But I think that there's a genuine disservice, and really selling people short of what they can handle and what they deserve to know about, because this is a reality for every living being. So
Yeah, absolutely, Mackenzie. And in fact, I'm gonna jump off script a little bit over to Megan, because what you just brought up, this fact that at times we feel like we need to protect other generations. Megan, something you and I have talked about is how that protection piece has actually created kind of even more of a bottled up need for people to talk about this. And I know that you have personally experienced grief at a young age that you weren't able to realize or process in the moment, had to process later. I wonder if you could talk to that for a moment.
Yeah. I experienced my first really big loss at the age of 11. And the adults in my life, as amazing as they were, it was sudden. It was somebody young. They didn't know how to talk to me. They weren't sure what was appropriate. They didn't want to scare me. And it made me confused and made me wonder why this thing was so secretive, made it even scarier. And so I really became obsessed with the idea of death and dying because I needed the information. And after being a public school teacher and after working with kids for as long as I have, especially, I spent most of my teaching career in high school. Kids are curious about things like that when we keep it from them. And so a lot of times the people in my life, the adults in my life thought, oh, she has this like unhealthy interest in death and dying and the like the process of it and where it happens and what happens afterwards, but they either ignored it or they just kind of shot it down. And so I think in my teens and 20s, I kept doing the research with knowing more, and being more educated, found more information, and then ended up falling into learning what a death doula was and getting into that work and realizing how many people are like me who really didn't get to experience grief at a young age and now are trying to own it, reestablish it, reprocess it, and share. So I think one of the biggest things for me has been with clients or with students that Death Wives has, talking about the fact that if we have kids, children in the environment, including them as much as we can, being creative with how we do that is hugely important. So how do we get kids involved the way that they used to be? Something that Death Wives talks about a lot in our classes is kind of the shift that happened in the US in the early 20th century that kind of changed the way that death looked. It wasn't happening at home. Funerals weren't happening at home. Other people started taking care of our loved ones when they passed. Kids stopped being involved in that. So if we think about somebody like my parents or boomers, they've never experienced an at-home funeral in their family, whereas my grandparents did, right? So thinking about how few of us know what some of that looks like and what some of that tradition is like, it just breeds that fear. And I think that leads a lot of people to death doula work because maybe they haven't had a formal education in it, they're not in the medical field, but it's something that they're drawn to because it's like in us, it's in our bones. Mackenzie said something similar. So I always advocate for people to find creative and engaging, and it's okay for it to be like kind of fun ways to process our grief and talk about it with kids and with our own, like our inner child deserves to do that too. So I'm a huge proponent of talking to kids about the life cycle as early as possible, and then talking about our own end of life as early as possible. So.
Wonderful. Yeah, thank you. And if I could take it one step back up, Megan, and then we'll jump back and forth between the two of you again. You spoke about how you're encountering more and more people who have had a similar experience, and I don't want to make any assumptions, but it seems like you saying that means that the people who are engaging in the education that you're providing at Death Wives and those courses and it's an intergenerational group. Is that right? Or is it?
Yeah, I think so. And I always start by saying, I always want to say that, death doula work instead, like hospice and a lot of palliative care options, you're really connected to the medical team and it can be really different. And so for us in the doula world, it's a lot more loose. We don't, so there's a lot of people that come to us at all sorts of stages in their lives. But I think what's really powerful is that, but because of that, I do come from working with, also as a white cis woman living in Portland, I'm working with people who are privileged enough to be connected to palliative care, privileged enough to have access to understand what a doula is, to be able to find me or Death Wives. So I'm coming from that. But I do see a lot of people coming and asking questions for themselves, for their own end of life planning. A lot of people coming to ask questions on behalf of their parents or grandparents. A lot of people who are in their 20s, 30s, 40s who are coming because they want to do it for themselves. We have a class on planning a home funeral and planning ceremony and ritual, and people come and talk about what they want and how they want to plan it now and continue to update it as needed, but they want to do it now. And so I think it's really great to have people who maybe have just got a diagnosis that are processing that alongside people who want to support their families. And everybody should have access to that education at whatever space they're at and enter whenever they can. But I do see a lot of people in their 20s, 30s, and 40s coming to our classes, engaging in the mentorships that the founders take on. And so it's really interesting to see how many people are coming to process their own grief, and then also to collect information they can hopefully present to their families. I think that's pretty common. And frankly, it's something I've done as a doula. It's a hard conversation even for my family, and it's something that I do for a living. So I think that's something I always like to throw out too. It has nothing to do with the amount of knowledge you have and everything to do with the relationship and how you bring it up and your family's comfort level and your community's comfort level with death. There are plenty of people in Portland and clients I've had who do have children connected because maybe their culture, their traditions are really, really strong, and they do death differently already. They don't really need a doula. They already have the plans. They know what they're doing. Maybe they just need help making a ritual or something. But I think there's this drive to understand where we come from. And I think understanding our traditions, understanding what we care about internally as human beings, that is what leads us to end of life planning, really. And I think that there's a lot of people under 50 who are trying to figure that out for themselves. I think COVID has also really increased the amount of time people are spending considering what they care about and considering what's important to them and the people that are important to them and the community that's important to them. And that has naturally led to a lot of people seeking this kind of information out, which I think is really beautiful, because the amount of trauma and pain you can process by filling out your own your own directive is so wild. So it's really cool to see more people doing that.
Great answer. I'm just like sitting over here like, yes, 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 yes. So thank you both for that. Mackenzie, I want to jump back over to you. Megan talked about the way that this comes up in our own personal, social, family circles and things like that. I wonder, what reaction do you get from friends or new acquaintances when you tell them that you work in this space? I mean, does it always kill a cocktail party, or like, how does this play out?
Well, I cannot say it doesn't. I used to, joke that I had this party trick, that I could silence and clear a room in one moment. What do you do for a living? Well, I work in hospice. And just a beautiful, beautiful cricket silence. No, but it's certainly all of that. But I would be remiss to say that there's definitely a variety of responses. I think that people have a initial, I would even go as far as to say programmed response that they need to kind of get through first before they can even realize how they really feel, or if they're actually really curious. So there's definitely, a first wall that comes right up, and there's generally, a response of either they put you in kind of a camp, oh my gosh, you're a Mother Teresa. I don't know how you could do that work. How do you do that work? That'll shut a conversation up pretty quickly. Or, oh, that's very depressing. I don't know how you could do that. But what I also find is that I think a lot of that has to do with, again, the fact that we just don't talk about it, that in a social situation as well, I think that people have a social awkwardness. It's a very vulnerable topic. It's not something they're used to talking about publicly in a group with their friends, especially with other young people. So I think there's two responses. The response they make as a group, make a joke of it. And then what I often find is 5 minutes later, they will often come and find me and we'll have another conversation that's very different from that, where, we'll really have interesting engagement, where they're, very, very curious, whether they want to talk to me about their loved one. That's a very often common thing that'll come up. Or, what are my thoughts about death? A lot of people think about this all the time, but they don't know how to communicate it because the culture is not conducive to that, so they don't really know. I think it's a social awkwardness around talking about death, so I think it's a topic hot on everyone's mind, is exactly what Megan was saying with COVID, especially. I think that, and which I think is again, a really, really beautiful, needed pause for people to really start thinking about these things. So yeah, I mean, it's definitely a mixed bag. I think that I'll often be surprised as well, meeting people in random places in a bank or a grocery store. It can often open up conversation. They see my name tag and they want to talk to me for an hour about grandma and that beautiful experience they had. And, it seems like people are just bursting at the seams to talk about it, and they just want somebody that they know that is safe to talk about it with, and they don't know who is. So, me, who is, self-proclaimed, I also find that I'm okay with the discomfort of it. I enjoy the discomfort. I like to dig into that discomfort. I think the discomfort is necessary. So I tend to be a little bit of a, antagonist. I'll kind of bite into things because I think that people really want to talk about it. They just need to get over themselves a little bit first. And so I'm happy to do that. I'm happy to make a joke and normalize it, because I think if every person could just a little bit more in their lives, maybe make a joke about death, just talk about it, normal conversation. I think those small little things that you have more interactions in your life have a really big impact, and it becomes a more normal thing. A lot of friends, whenever they have something going on, they come to me, they want to talk to me about it. And I'm no expert. I have my experience, but there's definitely a yearning to talk about it. And I think that we just too often assume that people don't want to, so.
Yeah, that's a great point, Mackenzie. Kind of the stick with it. Like if at first the response seems awkward, it's because it is for that person.
It is awkward. It's a good thing.
Yeah.
Good awkward.
I wonder, Megan, in your personal experience, kind of same question to you. How has this played out?
Yeah. I get a lot of the same responses I got when I tell people that I am a special ed teacher. It's a lot of the same, like, oh, you must be so no, I'm not special. I just happen to enjoy this. I think I tend to be, I'm pretty loud and boisterous, and I make a lot of jokes. When I talk about it, I tend to have people say, oh, I don't know what that is. And then like they'll Google it, and then they'll especially online. I have a consult with a tattoo artist in my neighborhood next week. And I told her what I did, and it's kind of part of the concept of the tattoo. And then she Googled it, and then she proceeded to call me to ask me a million questions about death doula work. And then she was like, oh, by the way, here's the appointment for your tattoo. So it just becomes this thing where, like Mackenzie said, people want to talk about it and they're curious. The joke is usually what starts it, which is totally fine. I think something that I tend to try to challenge people with when they talk about not wanting to talk about it or whatever is, I'll often say, like, well, we talk about all these other big moments in our lives that not everybody is going to have. Not everybody is going to have a wedding. Not everybody is going to have a baby or graduate from somewhere or buy a house. We celebrate all those things. We plan them. We talk about them with our friends. We have a housewarming party. We do all that stuff. But not everybody does those things. Everybody's going to die. And so if we can be talking about these kinds of things, and if we can make a joke about it and say, like, my friends know what things they're supposed to hide when I go. My husband knows. My husband has plans, right? My kid's got stuff he needs to do. We all talk about it because it's going to happen someday. And when we function from a place of crisis, we're not going to get things done. I always told that to my students. I work with a lot of students who had emotional behavioral concerns, and a lot of times we would just need to work and talk through things when they were calm in preparation for when they were in crisis and had to handle the same situation. And so really talking about death, talking about end of life planning now means that when something is happening, you don't have to think too hard about what you need. Your family doesn't have to think too hard about what you need. Your loved ones, your friends, your chosen family, whomever it is, or your palliative care team, they don't have to do as much thinking. And then you get to focus on yourself, your family gets to focus on you, and you get to have a better, more joyous experience, just like you would have if you took all that time to plan another event. So I try to challenge people by saying, especially because a lot of my friends are not having kids by choice. A lot of people don't have the same kinds of traditional weddings, at least here in the Pacific Northwest. And so I tell people, like, think about all that planning, that you don't want to do for this thing that you think is unnecessary, but death is necessary. So let's talk about it. And so that tends to get people like, oh, yeah, and I could kind of plan out like a wedding. Like, yeah, what music do you want? What kind of party do you want to have? And then it shifts the conversation to be more joyous and exciting and fun, which I think is like, it really is what it can be. And I think what a lot of other countries and traditions and cultures outside of America, like, white toast America, like there's some really beautiful, fun traditions that a lot of other people have kept going, and I'd like to see happen. So I love talking about making it fun, which maybe sounds weird to people, but I think it works, and my clients seem to enjoy it, and I know my party's going to be great. So
Love it. I expect an invite now. Long ways
Absolutely.
away, hopefully,
Absolutely.
but whenever it happens.
It's a constantly updating document, right? If you're breathing just like us, the guest list will change throughout everything. Yeah.
Love it. Love it. I want to jump into some of the questions that have come through the chat, but also save time at the end for one final question for each of you. So we'll try to do this lightning round style for a moment. And the first one is a question that's come up a couple of times is, do you think that people find these conversations easier to have with strangers than with their loved ones? And let's take this in the generational route. Is it easier to have this conversation, Mackenzie, with a 24-year-old who's working in hospice than maybe with the person that you actually know who's in that generation?
In my experience, yes. It definitely is. I think that, there's a lot of emotion wrapped around it. And again, we talked about kind of assumptions of what we think our family members feel and think, and a lot of fear and shame and embarrassment. So I've seen that, you're going to find somebody open up to you. They think you're a safe space, a third party, a therapist. I do see that quite a bit, but I would challenge that and say, take that, find, go speak to a stranger about it, fine. But maybe start with that, maybe practice a little bit, and then take what you've learned and then take it and go and speak with your family. Go. I challenge you to start it. It doesn't have to be, this whole big thing in one conversation. Just try it one night at dinner. What do you guys think about death? Start it, see what happens. Then another month later, try out another question.
I love it. Yeah, no, great answer. Megan, there's a question that I think you're particularly suited for that came in, and it's around this person gave this example of this amazing class that they had. They had an award-winning, they said, home ec teacher when they were in high school, who literally wrote the book on home ec, and talked about how in that class they talked about marriage, divorce, finances, even death and dying, living wills, death directives. They visited a funeral home, all of these different pieces. And so it was the best high school class they ever took, hands down. So, how is it that we integrate these pieces into our education journey? Just the same way that, I can remember, which now doesn't come to play very often, but learning to balance a checkbook,
Yep. Yeah. Well, as a public school teacher, I have plenty of qualms with the public school system. I don't think you'll find any of us who don't. But I think that there, unfortunately, funding in a lot of places has cut things like home ec. And so a lot of teachers I see piecing things together, which is really cool. But unfortunately, I don't see a lot of death and dying conversations, again, because I think that we are in a place right now where a lot of the people up top are of the age where they think that they need to be keeping that from kids, or of the generation where they want to be keeping that. I would have done anything for a class like that. That sounds amazing. But even the legality of field trips, going to a place like a funeral home at this point, just with the laws around that, you're going to find a lot of teachers can't do some of those things that they really, really want to because of restrictions of the system. So I wish that everybody could have that experience. But I think one of the ways that we can try to have those conversations with teenagers, I mean, I have, I've got one. One of the ways we can kind of have some of those conversations is, I find that one of the easiest ways is when we're talking about like celebrities that pass. I think that can be a really good way in to talk to kids about like what death is like in life cycles, and depending on how the person passes, talking about how that impacts the people around them. And it's kind of, for some kids, if they haven't lost somebody in their family or whatever, they aren't going to have that experience until somebody that they love dies. But we forget that a lot of us, and I mean, if you think back really hard to things that you cared about, like, I mean, DMX passing, like last, I cried. That's like my childhood, right? So we think about opportunities where we can have kids and young people practice their grieving and validate their grieving for this person that was important to them somehow. And coming up with ways to honor them and all that kind of stuff is a way that we can still be teaching them some of those things, even if it's not something that's like structured or built into the school system. I think that just kind of honoring those things as they come for kids and using those as a way to talk about death and dying can be really, really powerful and actually meaningful to them, and a little bit less, I'm not going to just sit my kid down and be like, so let's talk about advanced directives, right? Or like, let's talk about what palliative care is. But it just kind of eases into the conversation and normalizes it, so that when they have questions about how grandma and grandpa passed or whatever it is, they have some of the language and they know that it's okay to talk to you about it. So I think starting with celebrities, it sounds weird, but that's one of my tips to a lot of people when they're wondering how to talk about death with younger people.
Love it. There was just a great comment in the Q&A box about someone's mother who would talk about what comes after death and say that they were graduating from Earth School.
100%.
And joke about how none of us gets out alive. I love that. Thank you for sharing that in the chat. I think that's so
yes.
And you bring up a personal memory for me. I can remember when I a couple of years ago getting a speaker request for a fourth grade class that was had created a death and dying elective, and it had come out of the class deciding that they were going to try to save a skeleton that had been in the possession of the school for like multiple decades and was going to get thrown away by the science department or something. And this group of fourth graders organized and they saved the skeleton, and then questions came up about who was this person before and how did this come to be, and then it just kind of spiraled into this really beautiful genuine dialogue that their teacher facilitated. I remember being there and asking them questions like, what do you want your death to be like? And people saying, well, I think I'd want a puppy party with all and you just being beautiful, innocent, but true things that kind of came out of that. So again, all of this is encouraging. Okay. Yeah. Final And I hate to make it a lightning rounder, but we're coming to the end of our hour, which is, if you could provide one piece of advice, each of you, to folks that are of a different generation that are trying to interact with those that are younger, what would it be? Your pithy advice for those folks. I'll start with Mackenzie.
Well, I would say, along the lines of what Megan was talking about, I think kind of that like celebrity, starting with a celebrity, I think is a really good recommendation or suggestion in regards to taking someone where they are, and walking in the room, removing your assumptions, removing your judgments, removing everything you've placed on the situation and what you think that person is going to feel, think, or believe about death and dying. Anytime I'm walking in to meet with, a patient, a family member, a granddaughter, I ritually practice, I'm walking in a clean slate. I am simply whatever you need me to be in this moment. I'm going to be malleable. I'm going to adapt to you. I'm going to meet you on your level. And so that can look a lot of different ways. But, really as a practice of remembering, you don't expect to have, a great reaction, a bad reaction. I wouldn't say place any judgment on any of that. A good reaction, a bad reaction, any reaction is great. And be patient. Don't end the conversation. Maybe it didn't go so well the first time, or you think it didn't go so well. That's part of the process. So just be open to any reaction. And I also think that maybe even partnering with another young person, who, like Megan or myself, who has kind of that experience in this world, maybe a good kind of meet in the middle, somebody that they can kind of relate to generationally, that is talking about it, I think can be really freeing, and will open them up. Wow, she's okay with this. I see myself in her. So, if you have somebody you can kind of partner with that is maybe, young and hip, I don't know.
So
I
not
find that
me.
when I work with families, like the younger people will just gravitate towards me, because, I am younger. So they identify with that, and they feel safe to kind of talk in our language. So that's what I would say. Just be patient, be loving. Don't expect any response, and just be happy. Just be happy at the opportunity, no expectations, and just try it and keep trying it, and bring it up in different settings. I feel like the more exposure you can give, it doesn't need to be in a crisis situation. Just the more exposure in day-to-day life, the more it's okay and it's more normal. It's just got to be taking those baby steps. Yeah.
Love it. Thank you, Mackenzie. Megan, same question to you.
Yeah. One thing I always used to say to students when they were really overwhelmed with something I say to my kids, something I say to myself and my husband is, when we can identify the monster in the closet, it almost turns the lights on. So it's a matter of figuring out what this thing is that's causing us fear, anxiety, whatever. And once we kind of name it and point at it, all of a sudden it becomes a little bit less scary. So I think being honest is key. Whether you're somebody talking to your grandchild, whether you are somebody's great niece that wants to have a conversation with them, pure honesty, vulnerability. I feel this way. I'm nervous about this conversation. I think that's one of the most powerful things that I've ever had a client say to their family. I'm uncomfortable having this conversation with you, so I'm just going to lay it out there. I think that's huge. So being honest, being interested in what they have to say, like what Mackenzie said, no, don't have any expectations of their reaction, but be interested in their reaction. Similar teacher brain, all behavior is a form of communication. So if somebody is shutting down, that's a form of communication. So it's all telling us something. And then also explore your family, explore your traditions, do some Googling together. engaging in those conversations and finding things that maybe are meaningful to both of you in your DNA and in your spirit and all that stuff. I think having it be exploratory is really helpful. I know that's opened up some conversations for even for my family, for me with my parents. So definitely do some Googling, be honest, look up your traditions and turn the lights on if you can. Figure out what the big scary thing in the closet is. What is the thing that's keeping you from being comfortable in your own space?
Mm. Turn the lights on if you can. I'm gonna like write that on my mirror. I love it. I love it. I'm gonna do some final kind of housekeeping things, but before that, I just want to say thank you, both of you, Mackenzie, Megan. That hour went really fast. And I'm just delighted and inspired all at once. So I'm just full of gratitude for both of you. And on behalf of the 200 folks who are in community today, witnessing this conversation, I want to thank you both. So thank you very, very much for the opportunity to hear from both of you. There were a lot of questions in the Q&A box that were about kind of more practical questions around end-of-life planning. So I want to just make sure that people know where to find resources before we say goodbye today. On our website, we have a whole tab dedicated to planning care called our Plan Your Care Resource Center. It's got a whole host of different things for different situations. This is just a little sampling of some of those things that you'll find there, as well as tools that you can utilize to further engage in these conversations. We also have a exciting toolkit called our End of Life Decisions Guide and Toolkit that's available on the website, which is another good place to start if you're looking to answer some of those more granular questions. It's also available in Spanish for those who need that. And some other resources we also have a full COVID-19 toolkit. So if you are wondering about how that might affect your end of life planning, that's available at our website. I also just want to say, again, this is a year since the last time we had one of these, or since the first time we had one of these webinars at the beginning of COVID. And at that time, I was fortunate enough to be on that webinar and to say that we are not going anywhere in the midst of this pandemic, and we have not. And we've continued to try to provide content, community, and a difference in the world. And even in the midst of this pandemic, we just passed new legislation in New Mexico. There are campaigns happening across the country. So if the topics like these that are covered on these webinars or the work that we're doing is meaningful for you, all of our support comes from the generosity of individuals. So I encourage you to give if this is something that you find meaningful. Just to note, we have a couple other webinars coming up. An exciting one on April 22nd next week. Diane Ream and director Joe Fab are going to be talking about the documentary When My Time Comes. My mom texted me last night. She was watching that on PBS. So it is out there in the world, and we're excited about the conversations that it inspires, as well as our final webinar and our City of Hope Medical Aid in Dying and End of Life Symposium series. I believe this is the 9th webinar we've done with that institution. This one is on aid in dying medications and clinical competencies of prescribing. You can register for all of those on our website. And again, just a note, as we talked about at the beginning, we have all of these webinars available until the end of time or until the end of the cloud. And we have, they're all on our website. So here's just a host of those topics that are covered. And if you want to follow us on social, we'd appreciate that as well. It's a great way for us to stay in touch, especially in this moment as we are on the precipice of hopefully getting to spend some time together in person, but still figuring out how it is that we do that through our screens and in our homes. So with that, I'll wish you all well, and gratitude to all of you. Again, gratitude to Mackenzie and Megan, and to all of you for being in community with us today as we celebrate National Healthcare Decisions Day and figure out how it is that we make the world a little bit kinder. And so thank you all for being a part of that, and have a great rest of your day.